Hello surgeons, let's explore what we can do with the aspiration probe during cataract surgery. So first off, we can just stabilize the globe while doing the two side ports. It keeps the eye in primary. It's a blunt instrument and it can hold the globe uh, without affecting the ocular surface, without causing any bleeding, and without causing any discomfort if the patient is under topical anesthesia. This is a routine case, so this nuclear sclerosis in a 70-year-old female. Two paracenteses were made and the globe was stabilized or kept in primary during the paracentesis with the aspiration probe. Now, after we made the system, we're gonna hold the globe again and keep it in primary with the aspiration probe. See the blunt tip of it, and then we start the flap with the cystome, and then we're gonna hold the globe from the paracentesis using the aspiration probe, just to make sure that the patient doesn't move funny and we have full control of the eye during the rhexis. And this is a very important step. We don't want to miss that out. And then her section is going in, and we're gonna rotate this nucleus a couple of times to make sure that it's released and free and dissected from the capsule. And then we're gonna start taking down this nucleus. Now, it is important that we use or make the best use of the instruments that are already on the table. I use this instrument quite often and I find it very friendly and very helpful, and the fact that it has a very blunt tip and it's very skinny, it can fit through the paracentesis, the main wound, and small rhexis, small pupil. So it's really helpful. Back to the case here, we're gonna do some cortex cleanup, and then we're gonna do stop and chop technique, groove going in the middle, and then once we reach a good depth, we're gonna place two instruments inside, and we're gonna crack this nucleus 180 degrees. The full crack is noticed, and then a horizontal chop from the equator to the phaco tip. Two quadrants and one heminucleus is in the back. Now we're gonna wolf this down, starting with the 1/4 and moving on. Sometimes the nucleus can be very gummy and it's very difficult to crack, so I use the aspiration probe as mechanical chopper with the help of the dialer or a ball tip chopper. Two instruments are going inside the eye and kind of rendezvousing in the middle of the nucleus to crack it down. Back to the quadrant removal, aspirating it effectively, and since there is a large area of empty bag there, so we're gonna fill that area with viscoelastic and kind of lubricate the area so we can easily rotate the remaining half. We're gonna chop this in half as well, and then we're gonna emulsify it. So remember that the instrument table has so many instruments, and if you think outside the box, you can easily make different uses of every single instrument. Now removing the epinuclear shell and then supporting it to the ball tip chopper, lifting it up and then feeding into the phaco probe. Now we're gonna use the aspiration probe to kind of counter pressure the globe while inserting the sharp irrigation probe. Notice here that the irrigation probe is slightly sharp tipped, so we're gonna support the globe or counter pressure it while inserting the irrigation probe. Now peeling up the cortex, and now the aspiration probe can be used here directly while removing the cortex to mechanically polish the anterior capsule, especially in young patients It's a very important step so you don't have the PCO or early PCO. I tend to do the anterior polish like right after removing the cortex in each quadrant, so I don't have to come back again. Removing the cortex first and then mechanically rubbing the anterior capsule with the aspiration probe. Now, using the same, we can tilt the aspiration probe a little bit, and then we'll mechanically polish the posterior capsule as well. Now we're gonna fill up the AC in the bag with viscoelastic. We can use this step as a bonus, lifting the pupil and iris margin with the aspiration probe to inspect underneath. It's a blunt instrument and it's very useful and can reach to the far equator without the fear of rupturing anything or causing any damage. Now injecting the IOL into the bag. Now centering it with the bolted chopper. Now we're gonna remove the viscoelastic from the eye. Again, the aspiration probe is very effective here. Now we're gonna slide under the optic and lift it up with the aspiration probe to clean up under the optic and free up all the material from the posterior capsule. Now we're gonna use the aspiration probe to center the IOL, and then we're gonna hydrate the wounds and we're gonna close the case and we're gonna call it a day. So these are the different uses of the blunt aspiration probe during my cases. If you have any possible uses other than this, please let us know. Thank you so much for watching this case and have a great day.